Hello everyone. I welcome you all to today's session. Myself Rajita, as you know. So today we are going to discuss a very important and interesting topic in medical surgical nursing. So in this session we are going to discuss about something which is termed as cardiac emergencies. So I hope throughout the whole session you have learned regarding different type of disorders and disease condition which is affecting our cardiovascular system. So I hope there you've got the idea that majority of the problem or disorder related to the cardiovascular system can cause the development of a life-threatening scenario. Now, definitely, some conditions associated with cardiovascular system needs a urgent management, and because it's need a urgent treatment and management initiation, that is the reason we term those conditions as emergencies. So we are going to discuss today regarding cardiac emergencies. So there are a few disease conditions, as I mentioned, which are considered. We will be studying one by one about each disease condition, and we will be seeing what will be and we will be also seeing what will be the initial management to manage the client if there is any emergency present associated with cardiovascular system. So let's get started with the topic today. So first, before going to jump into the disease condition which are considered to be a cardiac emergencies, we should revise once about the basic concept of cardiovascular system. So already in details we have discussed regarding the anatomy of heart. Now already we know that heart is a pumping organ, that is a major organ which is present or which is associated with the cardiovascular system in our body. Now this pumping organ is the one, because of its activity or functional ability, the blood circulation will be continuing throughout the body through the blood vessels. Now, the anatomy, if we are going to discuss it and revise it, we're going to see the heart is majorly divided into four chamber, or we can say the heart is consisting of four chamber. The first one is right atrium, right ventricle, left atrium, and left ventricle. We have also learned that there will be septum present in between the atrium and in between the ventricles. So that is how the blood here is not going to be mixed. What I mean to see is the deoxygenated blood and oxygenated blood will be having different circulation throughout the body. And again, we have seen that between the atrium and ventricle, there will be tricuspid and bicuspid valves. So always we will be seeing a human individual will be having a one-way blood circulation. So we have seen throughout the body, the deoxygenated blood will be coming to the right atrium through the superior and inferior vena cava. Whereas this deoxygenated blood will be coming to the right ventricle. From there, through the pulmonary artery, it will be going to the lungs for the purification, where the blood will be losing the carbon dioxide what it was carrying from the body or throughout the body cells, and it will be replaced with the oxygen from the capillary bed into the lung. After getting oxygenation, the oxygenated blood will be coming through the pulmonary vein into the left atrium. From there, it will be coming to the left ventricle, as well as it will be going to the aorta, and after that it will be circulating throughout the body. So I just given you fast revision. I hope you are able to remember whatever we have taught about the anatomy and of the heart. So as you are clear with that, we have also learned about the circulatory system, how it works. So I have already mentioned that in our individual's body, we are having a complete separate one-way blood circulation. So in physiological condition, a person will not be having any backflow of the blood in their body. So it will be having a complete one way. So if you consider that the blood flow is starting from the left atrium, that is the oxygenated blood. So what will happen from left atrium? It will be coming to the left ventricle. From there, it will be going through the aorta towards the all body tissues. Then as the body tissues there, the blood is exchanged with their oxygen and it is taking up all the metabolic end products as well as the carbon dioxide from the body cells. Now this deoxygenated blood will be coming back through the venous system into the superior and inferior vena cava. So as it is coming here, we are going to see this deoxygenated blood will be getting accumulated into the right atrium. From there, it will be coming to the right ventricle. From right ventricle through the pulmonary artery, it will be going to the lungs for the purification. Once the purification is done, from pulmonary vein, it will be again coming into the left atrium. And the same thing repeat again and again. So I hope till here you have completely got a clear picture about the anatomy of the heart, in the functions of the heart, basically about the circulatory system. Now we have also seen something regarding about the conduction system. So you need to remember the conduction system is a very important part of cardiovascular system. So definitely we are going to see the conduction system will be composed of certain parts, or we can say certain cells which are having the potential to generate electrical impulses on their own. Now it is a basic characteristics which is present only for the heart muscle cells. We've also seen the majority of the cases, the most two important cells here will, or tissue branch here will be composed of this type of cells which are having the potential to generate the impulses on their own. It includes the sinoatrial node, which is generally located into the right atrium. It even includes the atrioventricular node, which is present in between the atrium and ventricle septum. Then we have seen also in the conduction system there is presence of bundle of His and Purkinje fiber. Now these are the specialized group of muscle cells which are present only in the heart and will be generating the electrical impulses. Now, I hope where we have discussed regarding the conduction system of the heart, you remember that we have seen the SA node will be generating the electrical impulses and it will be co-emerging into the AV node. From there, it will be coming to the bundle of His and then to the Purkinje fiber. That's how, because of the electrical potentials or electrical impulses, we are going to see the muscles of the heart will be having continuous contraction and relaxation. That is the reason why here the heart will be continuously maintaining the pumping actions. It will be contracting. So when the pressure will be increased and the blood will be flowing or circulating throughout the body, and it will be relaxing when the blood will be coming or getting accumulated into our ventricle and atrium. So generally it will be following two particular steps, where in the first step we're going to see the SA node or the sinoatrial node, which is located into the right atrium, will be generating the impulses. So that is when we are going to see the atrium are contracting. So once the atrium is full of blood and the electrical impulses are generated, atrium is contracting, what will happen? The pressure here will be increased compared to the ventricle. That is the reason the valves or one-way valves will be opened and the blood will be coming from the atrium to the ventricle. Now, once it is done, we are going to see next step. Once all the electrical impulses are coming and getting immersed into the AV node or atrioventricular node. Now, then the atrium contraction is over. The next step is when the atrioventricular node is circulating the electrical impulses throughout the bundle of His and Purkinje fiber. We're going to see the ventricular muscle here will be contracting, and that is when the blood from the ventricles will be circulating from the pulmonary artery and from the aorta, right? So that is how the heart will be continuously maintaining a coordinated action through which the blood will be circulating throughout the body. Now remember, the circulatory system or the cardiovascular system is one of the most important system of our body. We can call the heart as a vital organ. Because why? Because we have seen the circulation or the blood circulation only will be keeping our cells alive throughout the body. Once, even in a minute position or location, if the circulation is impaired or interrupted because of any emboli formation or any other disease condition, we're going to see within some time of duration, the particular part will go under necrosis, where tissue death will occur. And due to that, even a person can lose their functional ability. So I hope you're understanding, if this blood interruption is occurring in any of the vital organs of the body, the person even can develop a life-threatening scenario. Even it can lead to death. That is the reason why the circulation and the cardiovascular system is so important, and few of the disease condition which is affecting the functional ability of the heart and the pumping option of it, we're going to see those are considered to be the cardiovascular emergencies. So I have gone through the whole system of cardiovascular system a bit faster here, because we have already discussed in details about the cardiovascular system, about its functions and anatomy in details in the starting of the session, right? So here we are going to now learn about the cardiovascular emergencies. So let's get started with the topic of cardiovascular emergencies. So as we know, the cardiovascular disease is the major cause of adults' mortality and morbidity. So majority of the adults who are almost a year age of more than 50 years, we're going to see cardiovascular disease is the most commonest clinical problem seen among the general population. Now, as I have mentioned, almost all disease conditions associated with cardiovascular system can actually interrupt the blood circulation of the body, which is ultimately can cause a development of a life-threatening scenario. That is the reason a prompt recognition of the need and initiation of early management definitely save lives during the first stage if it is done. Even in case of most deadly cardiac conditions or cardiac emergencies, if the recognition of the signs and symptoms is done at earliest and the treatment initiation has been done very promptly, we can see the person will be having more chances of survival. Now, we're going to see what are the basic conditions considered to be the most horrible cardiac emergencies. So let's get started with the disease conditions. So I hope we have learned all this disease condition before separately. So we are just going to have a revision, and we are just going to have a revision about the initial treatment management of cardiac emergencies. So the first and foremost important and common cardiovascular related issues which is considered to be an emergent scenario is angina pectoris. So the second one is myocardial infarction. So I hope you are well aware now about the terminologies of angina pectoris as well as myocardial infarction. Although after reading all the disease condition, we are going to have a short discussion regarding each one of the disease condition here. So angina pectoris and myocardial infarction are considered to be the most commonest cardiac emergencies seen in clinical practice. The next being congestive cardiac failure. Cardiogenic shock is also a very common type of cardiac emergencies. Aneurysm is also considered one of the most major condition which can cause the cardiac emergency. Cardiac tamponade and pericarditis even needs a very urgent treatment and management to save the life of an individual. That is the reason this condition also considered to be one of the most important cause of the development of cardiac emergencies. So I hope you remember about angina pectoris. We have discussed in detail how it occurs, what are the etiological factor, clinical manifestation, even the pathophysiology. We have separately discussed about the management of this condition too. Here we're just gonna look into in a very brief term that what is this condition of angina pectoris. For the revision purpose, the angina pectoris is basically will be manifested with a severe chest pain, now which is generally caused because of the reduced blood flow to the heart muscles. So when the blood flow here is interrupted, we're going to see the heart muscle will be in a long term condition or in a long durated condition. The heart muscle cells will be having lack of blood flow into it. That is the reason why there will be infraction development, which is ultimately will be causing or developing the development of severe chest pain. Now this condition is termed as angina pectoris. So we have seen the basic etiological factor. Now this can be because of certain underlying condition which is ultimately interrupting the blood flow to the coronary arteries. So the detail of the angina pectoris, you can see the video where we have discussed in detail regarding only this condition of angina pectoris. So what happens basically, the symptoms here will be almost always associated with the coronary artery disease, where the thrombus formation in the coronary arteries will be ultimately disrupting the blood flow to the different location within the heart muscle. Now, almost always a person here will be complaining regarding squeezing type of pain over the chest, as well as in some cases where you can see the client will be having referred pain. So they may complain about the pain even in the neck region of the jaw, even basically the left upper arm will almost always will be associated with in the case of angina pectoris. We're gonna see the client here also is gonna complain about pressure or increased pressure within the chest and discomfort and heaviness within the chest, often associated with this condition. So you need to make it clear once these symptoms are present among an individual. Now, even these symptoms can be very mild, but it is indicating that the client needs our earliest management. So that is the reason it is always suggested to the general population that once the person is complaining regarding any chest discomfort or pain which is located in the backside or upper back area, in the neck and jaw, or maybe the arm, they need a assessment or a clinical assessment to make sure that the client is not going to develop with any complication associated with this particular condition. So next we're going to learn about myocardial infarction. So already we have learned that myocardial infarction, we are going to call this condition when there is necrosis formation within the heart muscle cells. Now, it is one of the most common type of non-communicable disease, as we know. So this cannot be transmissible from one person to another, but definitely this particular myocardial infarction is considered one of the major common cardiac emergencies which need a very prompt recognition and treatment, because this particular condition is gradually progressive, which ultimately can disrupt the complete blood supply into the heart muscle cells. That is the reason, as the process of the myocardial infarction is a gradual process, that is the reason if the client is recognized with the earliest symptoms and managed initially, the person is not more likely to develop with any other complication associated with this condition of myocardial infarction. So that is the reason why we're going to see here the blood supply won't be sufficient enough to meet the demand of the heart muscle cells, and it will be going under degeneration, where the person will be developed with even the complaint or symptoms like chest pain, There will be presence of tachycardia initially. The person will be complaining regarding the uneasiness within the chest and heaviness within the chest. Even some client will be showing the symptoms as fatigue, weakness, restlessness, anxiety. Even we're going to see the client can have the development of dyspnea or difficulty in breathing in this case. So this is also considered one of the major common cardiac emergency which definitely needs a very prompt treatment procedure to save the life of the individual. Now we are going to consider the third condition that is known as congestive cardiac failure. So, as we know, as the term itself is suggesting congestive cardiac failure, in this case, due to certain problems which can be associated with the functional ability of the heart or maybe the anatomical structure of the heart, where we're going to see the heart is losing here the ability to function properly. So, it is when we are going to see the blood circulation even throughout the body can be disrupted. Now, the problem can occur either with associated with the feeling of the heart, or we're going to see sometimes the congestive cardiac failure even will be associated with the problem associated with the ejection of the blood. So two type of cardiac failure can occur. First one where we can see the feeling of the blood is interrupted within the atrium and ventricle. The second where we are going to see where the cardiac function is depleted, and due to that we're going to see the ejection fraction or the ejection ability of the heart is interrupted here. So that is how ultimately we're going to see the client can have disrupted blood circulation throughout the body, and they will be present with the sign and symptoms depending on the type of cardiac failure initially. Now, in common cases, the majority of the client will be present with the symptoms like shortness of breath or dyspnea, that is difficulty in breathing. Excessive tiredness will be almost always complaint from the patient. Basically, the client here will be complaining regarding a severe fatigue. Now, the shortness of breath will be almost always increasing when the person is having activity done or they are into some exercise or physical activity, and when the person is in a lying down or straight lying down condition, or we can call it as in a supine position. So we're going to see the client will be complaining regarding the increased severity of the difficulty in breathing in this position. We're also going to see the client here often will be complaining regarding a severe anorexia. In case of right-sided heart failure, we're going to see the client can develop with swelling, that is called as edema, within the upper extremities and lower extremities. That's how we're gonna see, or we're gonna look into the clinical manifestations which are indicating that the person may have developed with cardiac failure. Now, this is a condition which needs a very prompt treatment, basically to solve the underlying disease condition which is causing the failure of the heart. So, common causes of heart failure includes the disease condition which we have studied just now will be associated with the cardiac functional disability. So, it can be because of the coronary artery disease, where we're going to see the myocardial infarction will occur, and due to that, the heart muscle cells will be going under necrosis and it will be losing their ability to contract and relax. That is when a client can suffer from or can develop the condition as cardiac failure. High blood pressure, or we can say hypertension, is also considered a very common factor which is almost always associated with the development of cardiac failure. We're going to see the atrial fibrillation, the valvular disease or valvular heart disease also can increase the chances or probability of the development of this condition of cardiac failure. Certain infections which is interrupting or which is associated with the heart and its structure, for example the infectious myocarditis, pericarditis, or maybe endocarditis, can ultimately cause the disruption of the heart functional ability. We're also going to see the cardiac myopathy, or the condition of cardiac myopathy also can leads to the development of cardiac failure. So generally, we're going to see heart failure can be of two type, where the ejection fraction is preserved, and one where the ejection fraction is reduced. So in such cases where the person are showing the signs and symptoms associated with this condition of cardiac failure, it needs emergent management. Next, we are going to discuss regarding the cardiogenic shock. Now, the cardiogenic shock, if you learn, or if you discuss in a very layman term, that we can say this is a condition where suddenly, due to some underlying pathological condition, our heart is not able to provide enough circulating blood to meet the demand of the body. That is when the cardiogenic shock develops. The condition here most commonly develop because of a severe heart attack, but not necessarily everyone who get heart attack or cardiac failure will be developing with cardiogenic shock. So definitely it's often very deadly if not treated early. That is the reason the underlying pathophysiology, whenever it is occurring, if it is managed, there is less chances of the development of cardiogenic shock for an individual. So now here we're going to discuss regarding the aortic aneurysm. So we have learned before that the aortic aneurysm basically is a condition where there will be formation of a balloon-like bulging structure basically into the aorta. Now this is the largest artery which carries the blood from the heart throughout the body. So this particular aorta will be having increased blood pressure. That is the can be the main cause why the bulging formation is occurring within the aorta. Now in such cases we can call it as aortic aneurysm. Now why it is considered to be one of the most common reason for cardiac emergencies, let's discuss. So this aortic aneurysm, once it is formed, it can go under the formation of dissection and rupture. So sometimes it happens that once the bulge formation or the balloon-like structure formation has been occurred, next we're gonna see, due to the increased blood flow or pressure of the blood, we are gonna see the layers within the bulging portion will be getting segregated, and the leakage of the blood will occur between the layers within this bulge or balloon-like structure. That is what, or that is when we can call this term as dissection of the aortic aneurysm. In the next condition, we are going to see, due to the dissection and increased pressure within the balloon formation which has occurred in the aorta, due to the increased pressure, sometimes the bulging portion can be getting ruptured, when it will be followed by episodes of internal bleeding. Now, due to the internal hemorrhage, here the person shows the sign and symptoms which indicating that it's a emergent condition which need earliest management, basically a surgical repair of the bulged portion what have gone through a rupture. Now, rupture is the main cause associated with aortic aneurysm, which cause maximum of the death of an individual related to this condition of aortic aneurysm. So next condition we are going to discuss about the cardiac tamponade and pericarditis. So this is a condition where we're going to see the pericardium layer of the heart will be increased or inflamed. Now cardiac tamponade is a condition where excessive amount of fluid buildup is occurring within the two layers of the pericardium of the heart. That is when the cardiac tamponade will be developed. Now, as it is creating extra pressure outside of the heart layer, that is when a heart can lose their functional ability to contract and relax adequately. So here, the person needs earliest management and treatment to prevent any complication related to pericarditis and cardiac tamponade. So I hope you understand, in this condition, the blood or fluid collection will occur, or the pericardium will be going under inflammation. associated with any infection or pathological changes, where the pressure within the or pressure outside of the heart will be increased, which will be disrupting the contraction and relaxation ability of the heart. Now, it can occur due to dissecting aortic aneurysm, which is almost always developed into the thoracic region. End stage lung cancer sometimes can cause the development of cardiac tamponade. We're going to see acute myocardial infarction, a surgical procedure associated with heart and its layer also can cause the development of cardiac tamponade. Bacterial and viral infection associated with pericardium of the heart also can develop the condition of cardiac tamponade here. So this is a condition, as I have mentioned, definitely it needs a very urgent management in order to prevent the development of complication, or to be precise, to prevent the development of complete functional disability of the heart. So now, as we have studied regarding the conditions which most likely to consider one of the major cause for the development of cardiac emergencies, now we are going to learn here regarding the common sign and symptoms which are most commonly present among the individual who are suffering from all this above disease condition. Now, always remember the clinical manifestation within the cardiac emergencies can vary from person to person, because as it is related to the underlying pathology, so depending on the pathological process, the location or the site of the cardiovascular system where the pathological changes has been occurred, due to the pathological process or pathophysiological process, the sign and symptoms will be varying from each person. But here we're gonna just have to learn about the gist of clinical manifestation which are commonly seen among the individual. Now, even we can say, or I can say that this sign and symptoms you have to into the mind so that you can recognize at earliest if any of the individual is developed with some symptoms. It does require a urgent clinical assessment, and if there is any presence of pathological process, it needs our earliest treatment to prevent the complication and the life-threatening scenario development. So let us study now regarding the common symptoms which are or which can be present among the individual who are having or who are developed with a cardiac emergent condition. So we're going to see here the common condition includes chest pain, which is basically a prominent sign and symptoms associated with any of the cardiac condition. Almost always we medically term this condition as angina pectoris, right, where the person will be complaining regarding the severe chest pain. Now, if a client is increased with the severity of the pain during the exercise or activity, it is definitely indicating that the client is having a potential development of disease condition associated with cardiovascular system. Now, if the client is in a progressed state of this disease condition, we are going to see the client here will be having the chest pain even at rest. So it is definitely indicating that the client have a progressed disease condition which needs our earliest treatment. So whosoever is complaining regarding even a mild chest pain, that has to be clinically assessed in order to find out any pathological alteration. Now, client associated or clients in a cardiac emergencies often will be complaining regarding a discomfort within the chest, pressure or a feeling of fullness within the chest, squeezing pain and a heaviness. Often this complaints does indicate that the client may have developed with certain condition which is disrupting the functional ability of the heart. Now, diaphoresis or excessive sweating is also an indication that the client is having cardiac emergency or can have the development of cardiac emergencies. Often the client with this condition will be complaining regarding anorexia or loss of appetite. Nausea and vomiting is also very common symptoms. Now, at initial stage, majority or the maximum of the client with cardiac emergencies will be showing a tachycardia. Even it can be associated with tachypnea, that is increased heart rate and increased breathing in order to maintain the demand of the body. But in progressed state, we may see the person may develop with bradycardia. Weakness and fatigue is also a very common clinical symptoms present among the client suffering from this disease condition of cardiac emergencies. We're going to see majority of the client can have loss of consciousness if the blood circulation is disrupted into the cerebrovascular circulation. Dysarrhythmias are often seen in a clinical assessment within the client with cardiac emergencies, which is definitely indicating that the client needs urgent management of the underlying pathophysiology. Anxiety and irritability also are very general symptoms associated with the patient who is suffering from cardiac emergencies. Now, we are going to see some frequency of the symptoms here. In almost all the client, we are going to see they will be complained regarding a chest pain, heaviness, and a discomfort within the chest. The diaphoresis will be present among 78% of the individual who are at emergency associated with cardiovascular system. We're going to see chest pain will be complained, as I mentioned, in case of majority. Even mild chest pain will be almost always present in 64% of the individual who is suffering from cardiac emergencies. We're going to see nausea and vomiting will be complained by 52% of the client who is suffering from this condition. Shortness of breath also will be complained from 47% of the client who is at a cardiac emergencies. So I hope you are getting the idea that these are the most common feature which does indicate that the person is in an emergent scenario which needs urgent management and treatment. Atypical presentation associated with cardiac emergencies includes chronic fatigue, sudden onset of some unusual shortness of breath or difficulty in breathing. Also, we're going to see there can be presence of nausea and vomiting, pain over the jaw, neck, back, even the left arm or both the upper arm are almost always included in this procedure or in this process of cardiac emergencies. Now we're going to see the diagnostic studies which are often will be done to the client to recognize or to conclude the diagnosis or to find out the reason behind the development of cardiac emergencies. Now, you need to have a clear idea that at a point when the client is in a need, we are definitely going to start with the basic life support initially to manage the client. Now, before that, we will be providing or we may perform a physical examination to find out the client's state. So we can say as a diagnosis or diagnostic method, first we will be assessing the client through a thorough physical examination and by checking the vital signs and their hemodynamic stability. If the client is in a deeper need, we're gonna use the basic life support initially to stable the client's airway, circulation, and breathing. Then only we will be going for the further diagnostic studies here. Now, the most common diagnostic studies which will be performed among the client includes the electrocardiogram. So it is a very basic procedure which even can be done while assessing or while performing the basic physical examination for the client. We will be trying to collect the history as much as possible from the caregiver or from the family member or from the person who have brought the client to the hospital setup. Now, once the situation is stable, we may go for an echocardiogram to find out the exact pathophysiology which is causing the cardiac emergency development. We are also going to see the client here can be going for a stress test. Cardiac catheterization can be done if there is any indication that the client is having any blockage or any significance of myocardial infarction or coronary artery disease, even in case of acute coronary syndrome. Laboratory findings often suggest the condition or the severity of the extension of the disease. So we're gonna see, we will be studying regarding the complete blood count, the erythrocyte sedimentation rate should be measured here to identify if there is any abnormal inflammation has been taken place. Electrolyte or the study of the electrolyte should be done to assess the client's condition and the client's need for the fluid electrolyte replacement. We're also going to see associated laboratory findings, which also includes the liver function test, the kidney function test, which is basically will be indicating the creatinine level in our body. The blood cultures often will be done to find out whether there is presence of any infection associated with this condition. Thyroid stimulating hormone or the hormone studies also will be done here to find out the reason behind the development of cardiac emergencies. So I hope you've got the idea now. Depending on the client's pathological process, the treatment will vary from patient to patient. Now, if you ask about the treatment procedure for each of the disease condition, already we have mentioned the disease condition, everything, whatever I have discussed in this video in detail separately, and also we have discussed detail of each particular disease condition and its management. So you can refer those to understand the concept more clearly. So I hope you got the idea that in case of a cardiovascular disease where it is causing an emergent scenario development, we definitely needs to first ensure that the client is maintaining a hemodynamic stability. He or she is maintaining their airway or patent airway, a proper circulation, and a proper breathing. After that only we are going to perform the diagnostic studies or detail of the diagnostic studies to find out the reason behind the development, and we will be treating the client according to the pathophysiological process which is present among the client. So management follows the steps. So the first steps include the performing of initial assessment as I have mentioned. So while performing the initial assessment, it should be a very quick and rapid assessment where we will be assessing the client's health or throughout the head-to-toe examination will be done, which also helps a medical professional to identify the clinical feature which are present among the client, and also identify or help the medical professional to identify the actual and acute need of the client in an emergent scenario. Now, in case of a severe emergency, first we will be introducing the basic life support. Once the client is stable, we are gonna do the focused health history collection, a thorough physical examination again, and we will be checking the baseline vital signs and hemodynamic status of the client. Now, if in this position of emergency, the clients meet the criteria of administration of nitroglycerin, with the consultation of a physician, we may administer the nitroglycerin to save the clients. Now, it is a very important role while managing a client in cardiac emergencies that they should be kept on a very comfortable position. High concentration of the oxygen can be administered here if there is any need. Now, definitely the clients need to be promptly managed if there is no history of cardiac problem. If there is history of cardiac problem but no nitroglycerin administration, and if the systolic blood pressure is less than 90 to 100. So this particular condition definitely needs a very prompt management and initiation of a treatment. Now, while managing the client in the emergency situation, you need to keep the rights of the treatment in mind. Now, this rights includes the right patient, the right drug, right dosage, right route of administration, right time, and the right documentation, and also right to select the treatment modalities. So almost always we will be keeping the rights into the mind, and then only we will be initiating the management to the client. So, nitroglycerin administration can be done if the client is on oxygen mask. We will be removing the oxygen mask and we will be keeping the nitroglycerin just below or under the tongue. And again, we need to place the oxygen mask back here. We will be repeating the nitroglycerin after 5 minutes if the indications are as follows. So, if at all for the first nitroglycerin or after the first nitroglycerin administration, the patient have not got any relief from the sign and symptoms, and if the blood pressure remains less than 90 to 100, we definitely need to re-administer for the nitroglycerin after 5 minutes with a consultation of a physician. Now, maximum nitrate dosage can be provided to a client for nitroglycerin or with nitroglycerin. Now, we need to also administer the aspirin if the patient have the problems associated with chest pain, no allergy to the aspirin, no history of asthma, as well as not or the client is not having a medical history where he is also on a medication or related to the clotting factors, and if the client is having the ability to swallow, we definitely needs to administer the aspirin as soon as possible in an emergent scenario. So in cardiac compromises, as I have mentioned, always we will be or we may be need to be administered the basic life support. So one rescue or cardiac pulmonary resuscitation will be done if there is no other medical professional is present. So we also should use AED, that is the advanced life support. We sometimes need to provide the high quality compression while performing cardiopulmonary resuscitation. Even if there is presence of two rescuer, we should follow the whatever the procedure should be followed while performing the cardiopulmonary resuscitation. Now, the basic life support in advanced life support, how it should be provided to the client, what are the basic steps and what are the approaches, the everything and the in detail have been discussed in the session where we have discussed only regarding the procedure of basic life support and advanced life support. We're going to see generally here the ABC approach will be followed, that is maintenance of the patency of the airway, breathing and the circulation, which definitely needs the administration of oxygen and chest compression to revive the functional ability of the heart. Now, BLS or basic life support will be performed from those medical professionals who are well trained in a clinical scenario depending on the client's need. So as I have mentioned, the automated external defibrillation also can be used. Now, this is external machine which helps to provide shock depending on the client's need. So when connecting an automated external defibrillator, there should be some steps to be followed. So the all clear method should be followed here. So when putting or when administration of this defibrillator, nobody should touch the patient and the patient should be on a flat surface lying down position, and they should not have or the environment should be completely safe for the client, even for the medical professionals who are going to administer this process. Now, automated external defibrillator is a very advanced technology where the rhythm of the heart will be assessed and needed shock will be provided to revive the client's heart ability to pump. So the discussion of the automated external defibrillation also has been done in the previous session. You can refer those videos for the detailed information of this condition. So I hope you got the idea here that we will be doing all the emergent management to the client just to revive the functional ability of the heart. Now, we definitely follow in the emergency situation regarding the American Heart Association's chain of survival, which ensures the early access to the medical regimen for each and every client, early initiation of cardiac pulmonary resuscitation as per the need of the patient, early defibrillation and early advanced care. Now, these are the four major factors which has to be kept on mind while treating a client in emergent condition. Now, in such cases, when if we are present at a primary health care where the advanced care are not available, it is our responsibility to refer the patient as soon as possible. That is how ensuring the access to the advanced care and early and effective cardiac pulmonary resuscitation is a very important part of the management of cardiac emergencies, which can actually save the life of an individual. So once the basic and advanced life support has been provided, reassessment of the vital signs and the hemodynamic stability should be done from a nurse or basically from our medical professionals. We will be ensuring that the client is maintaining a patent and stable airway and also maintaining a sufficient breathing and maintaining the circulation. If any needs arise, we should maintain the patency of the airway and provide oxygen externally. We're going to see the client will be suggested if in a stable condition to go or to undergo varieties of diagnostic studies, which definitely helps us to find out the causative factor which is causing the development of emergency situation. Now, treatment should be initially done to manage the client. After once the client is in a stable state, after the diagnostic tests, the finding of it should be assessed very promptly. The decision or the conclusion of the diagnosis should be made very promptly, and initiation of the treatment should be done as early as the diagnosis is made for the client. So, for example, if a client arises with the cardiac emergencies due to myocardial infarction or basically with acute coronary syndrome, we're definitely going to see the cardiac catheterization will be performed or angioplasty will be performed for the client to manage the scenario. Now, as we have discussed regarding the detail of the management, now we're going to learn about the nursing roles and responsibilities in case of managing of a client who have present in the cardiac emergencies. So, assessment and reassessment will be continuously performed by the nurse in case of emergency, even when the client is out of the emergent scenario. We're going to see performance of the cardiac pulmonary resuscitation as well as usage of automated external defibrillator will be ensured by a nurse. There is a reason a nurse who is responsible to manage the cardiac emergencies should be having a well awareness and adequate knowledge to use the automated external defibrillator, as well as they should know about the providing of the cardiac pulmonary resuscitation. Now, administration of the emergency medications should be done as per the physician's reference or as per the physician's documents. So, definitely a nurse should be vigilant enough to administer the adequate drug and maintain a proper dosage of the drug for the individual who is at an emergency. And it is also our responsibility to make sure to reduce or prevent the chances of any side effects associated with this drug administration. Once the client is in a stable state, it is our responsibility to perform the needed diagnostic studies to find out the actual condition because of what the emergency has occurred. Now, the other role and responsibilities of a nurse includes maintaining or managing the fluid volume. Often a client with cardiac emergencies will be having deficient fluid volume. So, intravenous administration or fluid administration is indicated here. The dietary supplementation should be adequately provided to the client here. So often we're going to see the client in this case scenario will have to provide with a nasogastric tube feeding. So it is our responsibility of a nurse to administer a nasogastric tube feeding, even to select the feeding supplementation adequately for the client depending on their bodily need. Even the care of the patient with nasogastric tube should be done by a nurse. That is the reason we should be well aware regarding the usage of nasogastric tube as well as care of a client who is present with a nasogastric tube. We're also going to see often the client here will be introduced with catheter. So it is our role and responsibility to administer or to introduce the catheter for a particular individual, and also to check or maintain the patency of it, by through which we will be also providing the catheter care. We will be ensuring that the client is having no absolute chances of the development of infection associated with the catheterization. Now, the next part includes the monitoring intake and output, which plays a very important role and shows whether the client is maintaining adequate nutrition and fluid volume for them. Now, once the client is in a clinical setup, as a nurse, we have a major important role to ensure adequate rest and sleep. Remember, in cardiac emergencies, the client's bodily need has to be maintained within the normal range. And if the physical need is maintained here, definitely we're going to see the client will be adjust with the changes of the life associated with this condition. That is the reason proper and adequate rest and sleep should be provided to the client. Even it helps to maintain a psychological well-being of the client here in this case scenario. Administration of medication is a very important role of a nurse here. So in case of emergency situation, even when the client is out of the emergency scenario, our client medical professionals, basically a nurse, plays here to maintain their medical regimen to reduce the chances of the development of any complication. Monitoring of the client should be continuously done here by a nurse to ensure that the client is not developed with any side effects of the treatment, basically the medical regimen. Even there is no presence of acute indicator or acute severe sign and symptoms, which is indicating that the client is suffering or may develop with some complication. Maintenance of hygiene, or to be precise, reducing the chances of the infection for the client here plays a very important role. Now, in this cases where the client will be going under diagnostic studies, even they have to go for varieties of treatment procedure which needs to be done, require ensurement from the nurse that ensures that the client is not going to develop with any infectious disease condition. Now, here the nurses should be very empathetic to provide the psychological support to the client, because you need to understand the person here will be going through a severe pain and severe changes in their lifestyle and pattern. That is the reason why, as a nurse, we should provide a psychological support to the client to increase the effectiveness of the treatment regimen, whatever has been administered to the client. Educating to the client and to the family member regarding the nature of the disease, the pattern of the disease, the treatment procedure, whatever has been planned, and the rationale behind the treatment procedure, need or the importance to the adherence to the medical regimen and the treatment procedure, as well as we're going to teach the client and the family member regarding the necessary changes into the lifestyle which definitely required after the episodes of a cardiac emergency. So by educating the client and the family member, we definitely provide a preventive approach where the further complication development will be prevented, as well as we will be providing a promotive approach to treatment here, which definitely helps an individual to have a healthier lifestyle further. Now, it is also a very important role while the client is in a clinical setup to reassess continuously to monitor their vital signs and hemodynamic status. So, a nurse plays here a very important role to prevent the complication by assessing any early signs if it is has been developed for the client. Now, also, we will be educating and communicating to the client and their family member regarding the development of early signs, which can be the indicator of a life-threatening scenario development. So that is how a nurse is going to manage the client, and they will be also trying to meet the need of the client, the physiological need, their psychological, social need, even the emotional need once the client is in a cardiac emergent scenario. So I hope you have now got the complete idea regarding the condition of cardiac emergencies, We have learned about the different disease condition which actually considered to increase the chances of the development of cardiac emergencies. Even we have learned about the management of the cardiac emergencies in a general aspect. So I hope you've enjoyed the session. Thank you so much for attending the session. We will be meeting you guys to the next session.